Hi there, it's Matt here, and welcome back to the podcast, and welcome back to another of our AMA episodes, Ask Me Anything episodes. Well, it's really Ask the Two of Us episode, because it's myself, and I am joined, as I always am, by the brilliant mind of Dr. Eti Ben Simon. Eti, I always pronounce it in my own special way. Welcome back to the podcast.
It's the best way to pronounce it. Thank you.
So I think we've got lots of really fascinating questions, and we were just chatting very briefly before we started recording to say, I need to do much better at getting through these questions in a more direct, straight line, efficient, informationally rich, nevertheless, manner, rather than going just long-winded. So let's see if we can do that. Let us start with the first question.
Okay, the first question. The challenge is on. My sleep tracker says I get plenty of deep sleep, but I still feel exhausted. What could be happening here, and can we trust these devices?
Yeah, it's a good question. And it's a question I do get asked a lot in the public about either which are the best devices or are they accurate and what are the accuracies. Sleep trackers, whether they're in smart watch form or a ring form or a headband sort of standalone device, just so people know, they estimate sleep stages using a combination of different signals. And the sensors on these different devices are measuring these different signals. So one of the sensors is what we call an accelerometer, and it measures movement. One of the other things that they measure is your heart rate. So how quickly or slowly is your heart contracting? They also measure the variability from one beat of your heart to the next, and that is called heart rate variability. And then they can also measure some other parameters. Some of them measure your blood oxygen saturation, your SpO2 as the acronym there. And then some of them will also measure temperature as well. And it's by using a sort of a combination of these different signals together with signals, for example, of what time of day or night is it, that they will kind of do some clever algorithmic estimation of your sleep stages. So if you were to really push me, I think people like Oura Ring, and full disclosure, I am currently an advisor to Oura. So I do kind of know the way that they do it. I know how the bread is baked, as it were, there. So I have the best knowledge of them. But I think Oura Ring does a great job in terms of its accuracy. Apple Watch, I think, also does a pretty good job. The algorithm, if you look at the empirical data, does seem to be pretty good as well. I don't know if it's quite as good as Oura, but it's definitely up there. And then there's a really interesting company called Happy Ring. They also, it's another ring form factor like Oura Ring, but they do sleep staging assessment. But what they also do is clinical grade sleep apnea assessments. And then if you are signaled to have sleep apnea by way of just this ring alone, they will walk you through a clinical process of full diagnosis and full treatment. So it's a really interesting device. So I would say that those are probably some of the best in class. It doesn't really firstly speak to the second part of the person's question, which is, can we trust these devices? When we say trust, we're talking about accuracy. And when it comes to accuracy, these devices, you can think of them at a level of accuracy that is what we call a 2-class algorithm and then a 4-class algorithm. The 2-class algorithm is saying, how well does this device differentiate from being awake versus being asleep in terms of me, the person that's wearing it? So 2 classes, 2 categories. So it's a 2-classifier algorithm. The other is the 4-class algorithm. That's harder. That separates light non-REM from deep non-REM, from rapid eye movement sleep, from wakefulness. And I would say that in terms of the last part of the question, to trust them, Oura Ring, they probably have, I think, a 2-class algorithm accuracy of probably in the low to mid 80s. So it's about 80 to 85% accurate at determining whether you're awake or you're asleep, which is pretty good. And then the 4-class algorithm, which is much harder to separate out those individual sleep stages, there I think the last count was probably around about 75 to 78%. So you could then look at me and say, well, hang on a second, you're telling me it's 78% accuracy. It means that it's 22% inaccurate. Well, don't forget, however, that to get 100% accuracy at our sleep center, you need maybe $20, $30, $40, $50,000 worth of equipment. And within the tiny form factor of a ring for $300, $400, you can get 70, 80% of the way there. In some ways, that's bloody remarkable. What I do think is more appropriate or a better framework to think about these devices as trustworthy or not is the following. Don't think about nightly headlines. Think about weekly trend lines. And the distinction there is important. The distinction is about absolute accuracy versus relative accuracy. So what I told you there is on any one single night, let's say it has about a 78% accuracy, and I'm just pulling these numbers, they're pretty accurate, but 78% accuracy of determining those different stages of sleep. What's interesting, however, is that the ring has almost 100% relative accuracy, 78% absolute accuracy, 100% relative accuracy. What I mean by relative accuracy is that from one night to the next, if you see deviations in your data, it can't be the ring, because the ring is consistently inaccurate every single night. And therefore, from one night to the next, its relative accuracy is very, very high. Its absolute accuracy, still high, but not as good as its relative accuracy. Therefore, I don't fret too much about a weird one-night deviation in my data. I just think that that's probably an inaccurate absolute accuracy night. If over the next sort of 4 weeks, I see a trending decline in my deep sleep, I don't think it's the ring that's inaccurate. I trust the device, to the listener's question, because then the relative accuracy is so good. It can't be the ring that's the problem. The deviation is coming from me, the individual. That's when I sit up and listen. I hope that sort of makes sense as to at least the way I think about sleep trackers. In fact, I think about it, and I promised I would do short answers, but it's going to be the longest answer, listeners. I promise. I think about them in two verticals. When people say, what's the best sleep tracker? My answer is one that they don't really want to hear. I tell them the best sleep tracker is the one that you wear most frequently, because adherence, you can have the best device ever, like our sleep lab. If that was portable, it's 100% accurate, or almost. It's great. But you're not going to wear it every single night. After about 2 or 3 weeks, you're just going to take it off because it's terrible to wear. So your compliance is so low. So I think about these devices in a 2x2 matrix, the form factor and the accuracy. So I want a device that is low friction or no friction. So the ring is, I think, a low friction device, but the mattress, like 8 Sleep, that's a no friction device because you don't have to charge. It's always plugged in. You can literally drop into your bed in any shape or form, and it's going to record your sleep. So think about accuracy and form factor, and the interaction between those two is the sweet spot. That's where the Venn diagram overlap gets really juicy. Finally, to the first part of the question, I'm so sorry it took me this long to get there, which is I still feel exhausted even though I get plenty of deep sleep. What could be happening here? Several factors could be explaining why you still feel exhausted. Now, obviously, we are scientifically descriptive. We're not medically prescriptive, nor are we medically diagnostic. And I don't know the person's background or medical history here, but what could be happening firstly is that your deep sleep is high in terms of its amount, but your sleep efficiency score may be low, meaning that you spend a lot of time in bed, and therefore you can still get, on total mass kind of count, a good amount of deep sleep, but you're waking up a lot throughout the night. And therefore, your sleep is what we call fragmented. It's littered with many of these awakenings, some short, some could be longer. And that leads to a feeling of unrestorative sleep. And Eti, I think in the last AMA, you mentioned this very cleverly. We know that the continuity of your sleep, sleeping in one long, nice, consistent bout, or at least a couple of them, versus lots of choppy awake, asleep, even though 2 people could get 7 hours of sleep, but one took 9 hours to get there because they were awake so much. Even though it's the same quantity of sleep, the person who took 9 hours to get it will feel less refreshed and restored. And we still don't understand why this measure of the continuity of your sleep is so important. So that's one issue. The other is that you could have, for example, circadian misalignment, which is a very fancy way of saying your sleep schedule could be inconsistent and you're not sleeping at these optimal biological times, either for your chronotype and you're flip-flopping all over the sort of the clock face. You're kind of going to bed maybe 2 hours later one night, then an hour earlier the other, then 2 hours earlier. That back and forth can lead to unrestorative sleep, even though you still get deep sleep. Beware that you may have an undiagnosed sleep disorder. This is perhaps one of the most likely explanations. Conditions like sleep apnea, which can be associated with snoring. You could have something like periodic leg movement disorder, or PLMD. You could also have restless leg syndrome. There are a number of medical sleep disorders that you could have. Other things to keep in mind, we know that chronic fatigue syndrome, fibromyalgia, and certain mood disorders can lead to a mismatch in terms of both your deep sleep that you're getting and the restoration that it nevertheless provides versus the quality of the wakefulness that you subjectively experience when you wake up. Those things, those conditions can get in between the good sleep that you're having. And kind of when it's pushed through that filter of those conditions, you subjectively don't feel so great about your sleep, even though your sleep is really good quality sleep. And then the other thing I would just keep in mind, there is the placebo effect from these sleep trackers. It's what we call orthosomnia. Ortho in medicine means sort of straighten. Orthodontics getting teeth straight, orthopedics getting your bones fixed and getting them straight. Orthosomnia, getting your sleep straight and getting so anxious and worried about it that it does you a disservice. And there is some proportion, we don't really understand what proportion, of people who develop anxiety about their sleep, and it paradoxically makes them feel less well rested because they become so hyper focused on their sleep scores from their sleep trackers. Bottom line, sleep trackers, I think they provide an approximation of your sleep, and it's a very good approximation, but its single night accuracy is not quite as good as a sleep laboratory recording, at least not yet. But the relative accuracy is really good, as we described. And then if you keep feeling exhausted and you don't feel refreshed by your sleep, do go and see a sleep specialist. Usually try to find, if you're in, for example, the United States, a board certified sleep medical doctor. They will have the best chance at getting to the root of it. Eti, what have I missed? Please add some color and info.
I really want to emphasize the importance of seeing someone if you feel that you're constantly not being refreshed by your sleep. And also, I'll just say from personal experience, it's really easy to get an at-home sleep test. It's not as cumbersome as the ones we use in the lab. It's kind of a chest strap and a little finger sensor, and that would give them some indication if you have any sleep disorder. So it's really easy to do. You sleep with it 2 nights. They pick up the device, they do the analysis, and you just know if there's something wrong with your sleep. I just wanted to ask you, Matt, if you think that when we think about sleep trackers, is it a good analogy to think about training an AI model? So if you just get your device, let it run for a few weeks before you start seeing the trends. Does that make sense? Let the machine learn your sleep first.
It's a very good statement, because when sleep trackers first came out, they were in some ways out the box operating as they would for the rest of their entire lives, because there wasn't any real smarts behind the algorithm. The algorithm was hard coded like a circuit board. But now you're absolutely right. These devices take time to learn you. It's like having a new pair of shoes. You first put them on and it's a pretty good fit and they're a good pair of shoes. But if you kind of get those special shoes, I've got a pair of old Brogue boots. Gosh, I've had them years. I had them resold many times. But, when people say they just fit me like an old pair of shoes, that's what you're doing gradually by sort of using it over time. It fits around you in a more accurate fashion and it just feels better as a consequence. And so too is the data better as a consequence. It's not necessarily an ongoing process forever, though. You're right. It takes a couple of months to learn. And then for the most part, it is stable. And at that point, it's about as good as it's going to get from that point forward, shy of any software updates that they beam out. over these things called the interwebs. That was
It's
quick, wasn't it?
that was so quick. You snooze and you didn't lose.
Yeah. A partner and sponsor of today's podcast is Shopify. Let me share the link right away. Shopify.com/Matt Walker. As someone who spends his days researching sleep, the idea of selling merch felt, well, rather daunting. But I kept getting asked if I had t-shirts or gear. So I finally said, okay, Matt, get your act together and give it a try. And we have them coming. But the big question was, how on earth was someone like me, a scientist, going to get these items into your hands? Everyone said the same thing, use Shopify. It turns out, even me, an analog man in a digital world, was able to do it without any learning curve. Shopify is the commerce platform behind millions of businesses around the world and 10% of all e-commerce in the US, from household names like Mattel and Gymshark to brands just getting started. With hundreds of ready-to-use templates, you can build a really impressive online store that matches your brand style. Oh, and if you need artificial intelligence-powered help writing product descriptions or touching up images, Shopify's got that too. All of which is to say that if you're ready to sell, just try Shopify. So if you are interested, turn your business idea into reality with Shopify. Sign up for your $1 per month trial and start selling today at shopify.com/Matt Walker. Once more, that's shopify.com/Matt Walker.
All right, the next one is actually something that I think we all experience. I keep waking up almost at the same time, 3:30 a.m. every night. Is this normal? Is it bad? Is there a scientific explanation?
I've never experienced that. What are you
You've
talking about?
never?
It's common.
For me, I mean, you just change it to 5 a.m., but
I haven't heard of it. Of course I have. It's been the bane of my bloody existence for several phases of my life.
I know.
Yeah, it is really common. And please don't forget to, when I finish trying to explain at least my first pass answer, to come back to why you said for me, it's closer to 5 or 5:30. That actually is an important point that I will forget as I proceed. I would say
Okay.
that waking up at the same time every night, and here it for this person, it's 3:30, it is a common sleep pattern that many people experience. And while it can be part of a perfectly normal sleep architecture that we all wake up throughout the night, even babe, when you think, gosh, when I was like 7 or 8, I'd just fall asleep and that was it. The next thing I remember were, my parents trying to get me out of bed in the morning. Even then, you still will have woken up throughout the night. They're so short, you don't commit them to memory. So normal sleep is sleep that does involve waking up throughout the night. This is a little different though. Although it can be part of a normal sleep architecture, there are several scientific explanations that I think are worth exploring in greater depth as to why it seems to be somewhere around, for most people, this bewitching hour of sort of 3 a.m. The first has to do with your sleep architecture and what we call an ultradian rhythm. So an ultradian rhythm is a rhythm whose duration is shorter than 1 day. So dian from the Latin derivative dias meaning day. So ultra in terms of that is shorter. It's a compressed version. So it's a rhythm that is shorter than a day. None of which has to do with his explanation. Matthew, move on. So our sleep cycles follow this ultradian rhythm. And for humans, our sleep cycle ranges from somewhere between about 90 minutes to 110 minutes across most of the average adult population. And we alternate, as we've spoken about on this show, between non-rapid eye movement sleep and rapid eye movement sleep throughout the night. And we keep cycling through that non-REM to REM sleep cycle. What's interesting, however, is that as the night progresses, we spend increasingly more time in REM sleep and less time in deep sleep. And around the 3 to 4 a.m. time frame, assuming, let's say, a standard bedtime of around 11-ish, many people will naturally enter a period where their sleep starts to become lighter because in the first half of the night, that's when you get most of your deep non-REM sleep. And it's during deep non-REM sleep that is at least one of the stages where it's really hard to wake up from. But as we start to go through to the second half of the night, now we go into either rapid eye movement sleep or the lighter form of non-rapid eye movement sleep called stage 2 non-REM sleep. So that's the first explanation, is that right around that time frame is the inflection point where many people will naturally start to enter a lighter form of non-rapid eye movement sleep, making it easier to be awakened by external or even internal signals like changes in heart rate, or like the nervous system being a little bit overactive because you had too much coffee or you're a little bit stressed. The second probably component of this comes down to hormones and the circadian rhythmicity of those hormones. The body's internal 24-hour clock, your circadian clock, it regulates various hormones that affect sleep. One of them is cortisol. Many people think about it as the stress hormone, and it is in part the stress hormone. But we all need cortisol, and we all start the day with a nice rise in cortisol. But that cortisol rise begins long before we wake up. In fact, after dropping down to its lowest levels in the first half of the night during deep sleep, around that middle point of the night is when cortisol starts to surge back up, heading towards the morning early hours of its peak. And that prepares your brain and your body to wake up. Cortisol is an activating hormone. So as that tidal wave shifts from dropping down and down to now the tide coming back in of cortisol, that can be one of the triggering factors. We also know that melatonin, which is a sleep timing hormone, it typically peaks probably in the first couple of hours through until the middle phase of sleep, and then it starts to decrease again. So the signal for when you should be sleeping also starts to drop off around that middle point of the night, around the 3 a.m. timeframe. We also then further know that after your core body temperature has plummeted in the first half of the night, in the second half, right around that 3 a.m. time, is when your body core temperature starts to shift back in the upward direction. Why? Because once again, it's heading to the peak of temperature where you are going to be awake. The final thing I would probably say to this person, and it's the thing I would say first if they asked it to me as I'm out in public, I would say, how do you know it's 3:30 a.m. in the morning? And that's your first problem. Because looking at the clock is not going to do you any good at all. And in fact, looking at the clock starts to reinforce and train your brain into thinking, okay, after the first 4 hours of sleep, I need to be waking up because I've learned the association between this time of night being the time when I wake up and check the clock. So there was a great study done by our colleague here at UC Berkeley, Alison Harvey, and she found that clock watching at night made insomnia that much worse. So the advice here, and in addition to the biological explanations, would be remove all clock faces from the bedroom. Now, if you have to take your phone into the bedroom, that's fine, but just resist the urge to pick it up and look at what time it is. Knowing what time of night it is not going to help you fall back to sleep. If anything, it will make it worse. It's not your friend at that time. The other thing is, I would probably just keep in mind, once again, some sleep conditions like sleep apnea, or the other thing that some people quote, although the evidence, if you look at it, is not particularly strong, is that right in that middle point of the night is where our blood sugar levels drop to the lowest point. And some people have argued that when you become pushing towards that hypoglycemic state, it can also be another trigger for your body to be forced to wake up and feed. But I think that evidence, as how I read it, is not very strong at all. I think it's kind of a little bit of one of those kind of TikTok myths out there. Anyway, Eti, I know we haven't spoken about solutions to getting back to sleep, but I think we've spoken about those on the show many, many times before. But any other explanations to the 3:30 a.m. awakening? And this is going to be the second longest answer. After this, I'm going to be short. Take it away.
You wanted to mention something about the 5 a.m. wake up. Can I guess
Yeah.
that this is just shifting the middle of the night towards a chronotype that doesn't go to sleep at 11?
Yeah, that's exactly right. So what Etty described there, and she is a very ardent and I think very vocal and rightly proud person of being a night owl. I'm kind of mostly a neutral. I'm probably a little bit of a night owl, but for the most part, I'm neutral. Eti is a night owl. And you were saying that your kind of middle of the night awakening is not really 3 or 3:30 or even 4. It's more like 5. Why is that? It's because when you go to bed, it's a couple of hours later, and your chronotype, your natural circadian rhythm of this sinusoidal wave, this upswing during the day and the downswing at night, your sinusoidal wave that peak during the day and that trough at night, that's just pushed a little bit further into the night. So your chronotype version of a 3 a.m. awakening is a 5 a.m. awakening. So for people listening who say, I don't resonate with that 3 a.m. thing, it's always 4:30 for me, or other people who are extreme morning types who go to bed at, let's say, 9 p.m., they may say, oh, I always wake up at 1 a.m. It was just a really good point, Eti, that you mentioned, and I think it's to be clear, 3 or 3:30 isn't the universal. What is universal are the biological transactions that we spoke about that unfold across the first half into the second half of the night. And your first half of the night is going to change guard at around 5 in the morning, whereas someone who goes to bed at 11, they change their guard in terms of the flip-flop back and forth between the dominance of sleep stages at around 3 o'clock, and all of these other hormonal and chemical and body temperature changes. So I just wanted to make that point.
If only it was as nice as watching the change of guards in the Buckingham Palace. At least we had something to do.
Yeah, although I would be a little bit worried if those were the pajamas that you were wearing as you were doing your change of guard. I would say it's probably not permissive to the core body temperature reduction that we would wish for, especially those fascinating hats. Okay, onwards to the next question. And here comes, I'm sure, maybe a short answer depending on what the question is.
I'm not sure it'll be short, man. All right. During a recent sleep study, I was told I have alpha wave intrusion. I go for my consultation next week to discuss the results, but can you tell me what exactly does this mean for my sleep quality?
Yeah, so alpha waves, when we're talking about brain waves, we're measuring your brainwave activity by sticking electrodes on your head. And the speed of those brain waves, how many brain waves you're having per second, how many times do they go up and down per second, per unit of 1 second of time, is how we quantify those brain waves. So when we go into deep non-REM sleep, we have very slow, big, powerful brain waves. So your brain waves are going up and down maybe only 2-3 times a second, which sounds quick, but it's actually very slow for the brain. And we then typically kind of bucket the different speeds of brain waves into larger categories. So deep sleep is what we call delta sleep. Delta wave activity is the dominant type of activity that we have during deep non-REM sleep, or slow wave sleep for short. And there you could have brainwave activity where you're only getting one brainwave every 2 seconds. So there it's a very slow oscillation. And that would be what we call a 0.5 hertz rhythm. So in other words, only half a cycle per second. And therefore, for every 2 seconds, only then do you get a complete cycle. So from 0.5 hertz all the way up to 4 hertz, or 0.5 cycles per second to 4 cycles per second, is what we call delta brainwave activity, which sounds fast, 4 cycles per second, but it's actually for the brain very, very slow. Next one up is what we call theta brainwave activity. There, your brainwaves are going up and down somewhere between 4 to 8 times per second, 4 to 8 cycles per second. Then we have alpha brainwave activity, where your brainwaves are even faster. They're going from 8 to about 12 cycles per second, or 8 to 12 hertz, which is our measure of frequency. And alpha brainwave activity we typically see usually when you are awake, but your eyes are closed and you're in a relaxed state. And sometimes just as you're starting to slip into sleep, we also see that alpha brainwave activity. But when you are in deep, non-rapid eye movement sleep, normally we never see such wake-like brain activity, these alpha brainwaves. They're the purview and the territory of wakefulness, not of deep sleep. But What we can see in some patients is every now and again, there will be the presence of these wake-like brainwaves, these alpha-like brainwaves in the 8 to 12 cycles per second range, even though they are in deep sleep. And we think of it almost like a version of deep sleep that isn't as restorative as it could be because it has the invasion of some of these waking brainwave frequencies. So it typically can lead to people feeling as though, again, they have unrestorative sleep. And that's something that we spoke about in one of the first questions there. Where do we see this as a common place? Well, things like fibromyalgia and chronic pain conditions, they can often exhibit alpha wave intrusions, which can lead to non-restorative sleep and just basically daytime fatigue. You just don't feel very awake. Other conditions like insomnia, there are a subset of insomnia patients who can have alpha wave intrusions. People who have a sleep disorder called restless leg syndrome, they can have it, as well as people who have sleep apnea. I think there's some evidence back from Roseanne Armitage back in the mid 2000s where I think she was also finding alpha wave intrusions in mood disorders, particularly major depression. That may also be an explanation as to why people who have major depression don't feel particularly well restored by their sleep. Some other things, medications, antidepressants, and certain stimulants can cause these alpha wave intrusions overall. What does it mean for this person's sleep? Well, again, we can't be diagnostic or prescriptive here. But I would say if you are experiencing excessive daytime sleepiness, despite getting a quote unquote full night's rest, then for listeners out there, alpha wave intrusions could be one of the factors that is contributing to that feeling of not feeling very well refreshed, even though you think and it seems as though you're getting plenty of sleep. And it could be that way for this person too. So I would say try to address underlying conditions, just as you said, Eti, get an at-home sleep test from a board-certified sleep doctor, or even just a really good primary care physician who is attentive to sleep. But anything else there, Eti, on the alpha wave intrusions?
So I actually did my master thesis on alpha waves. I
Oh,
feel,
goodness. Of
yeah,
course.
it was kind
Yeah,
of my
yeah.
entry point to the wave brain world. And what's nice about alpha waves is that when you close your eyes, when you're awake, you can immediately see beautiful alpha waves at the back of your brain where your visual cortex is, because you're closing your eyes and your visual cortex is resting for a bit. And when someone falls asleep and the minute they close their eyes, we start seeing those alpha waves. Actually, for us, a sign that they fell asleep is those alpha waves disappearing. You really see it so dramatically on the screen. They just start becoming slower and it's not alpha anymore. And it's like a little capsule of wakefulness that you don't expect to see during sleep.
Indeed. And it's that intrusion almost as though you're overlaying atop a little bit of non restorative wakefulness on deep restorative sleep.
Yeah.
That sort of dilutes the overall sense of how well and refreshed you feel the next morning. So, good question. Okay. Next question.
Next is a great question that I personally experienced. Why is it that every now and then I have dreams about my teeth falling out? Why my teeth?
I think it's like teeth, and then people always thinking I've gone out without any clothes on the lower half of my body.
I
They,
also have a lot of, there is a test I forgot to study for.
yeah, and then there's that too, or for me, I'm turning up to a presentation and I can't find my laptop or my slide. I can't
Yeah.
get my slides, or I can't find the room. But let's stick with teeth for now. Dreams about teeth falling out, they are pretty common, and they seem to be. There's some people have studied this. They are quite universally reported across cultures. And cross cultural investigations are important for lots of reasons. But one of the reasons is that they tell us that it transcends cultural boundaries, which probably means, in part, it definitely has a more basic biological mechanistic root to it. And some people have overlaid psychological interpretations on this type of stuff. And I think Freud definitely had a go at that too. But I think it's really here I'm best served to offer the neurobiological explanations that are worth exploring. I would say probably the first and to me the most plausible is what we call facial nerve activation changes during sleep. And it's probably happening most commonly during rapid eye movement sleep. Because as we've spoken about on this podcast before, when you go into dream sleep, something amazing happens. Your brain paralyzes your body so your mind can dream safely. And so all of your voluntary skeletal muscles are temporarily paralyzed. And it's what we call REM sleep atonia. Often in medicine, anything with the letter A in front of it means the absence of, so arrhythmia, the absence of a normal heart rhythm. Atonia is the absence of tone in your muscles. And so you're locked in this physical incarceration. Now, thankfully, your involuntary muscles that control your heart and your respiration and therefore your breathing, they don't undergo the paralysis. Otherwise, we wouldn't have got very far in this evolutionary battle. But
Indeed.
what does this mean? It means that the facial muscles and the cranial nerves, or some of them, do seem to be partially still active during sleep. Now, you can see this when people either go into REM sleep or babies go into REM sleep or pets go into REM sleep. You'll still get these facial twitches. And I'm telling you, no, you're paralyzed. You're completely locked down in your body. Well, then how can you be having muscle twitches? Because some areas and some nerves still remain partially active. And the trigeminal nerve, which is what we call the fifth cranial nerve, that provides sensation to the teeth and the gums and the jaw. And that can experience spontaneous activation and then deactivation during REM sleep. And so this kind of random pattern of nerve firing from the trigeminal nerve can create a sensation of where you have teeth for a second because you have the nerve sensation of your teeth being there. And then it's lost because of the paralysis. And it results in you all of a sudden thinking, wait a second, a moment ago I had teeth and now my teeth are falling out. And that can lead to that misrepresentation of the brain in terms of which body parts and componentry is still attached to you. That's, I think, probably the most plausible explanation. Other people have noted that sleep bruxism has some connection, which is teeth grinding. That activates the masseter muscle of one of the jaw areas. And the physical activity stimulates the same trigeminal nerve, and it can create a sensory input from the teeth and the jaw that the teeth are present. And then when it stops, it results in a rebound experience of, oh my goodness, my teeth are going and they're falling out and they're no longer present. And therefore that flip-flop, because of the clenching of the teeth and then the relaxing of it, the stimulation of the nerve, then the release of the stimulation can mean I have teeth, I don't have teeth. I think there is some other, I can't remember who it was. Oh, it was an APS conference. But anyway, APSS, they suggested that facial muscle twitching and the transition between different stages. So here we're moving outside of REM sleep specifically. These facial muscles may experience minor twitches, and that twitch and then the relaxation pattern can create a sensation around the mouth and the teeth, because it's really around the face where you get these twitches that can have or give you a sensation of sensory presence of teeth versus sensory absence of teeth. And therefore, all of a sudden, you had a full mouth of teeth at one moment, and then next scene of the dream, you don't. So I don't think we have a really good explanation, but I think probably right now, for me, at least based on the data, my money is probably on the changes in the facial nerve activity and specifically the trigeminal nerve.
I love it how historically we move from dreams being completely subjective and there is no way to interpret them other than to speak to the individual and their own associative network, into sort of Carl Jung, which talked about archetypal dreams that people have across cultures. And now putting that biological foundation on those typical dreams that people have across cultures and helps us understand why we have this subjective experience coming from all the physiological changes during REM.
It's fascinating, isn't it? And I think it goes in circles because what you're talking about here is going from an absence of a framework where we would perhaps ascribe these experiences to the soul or the gods or all of these types of things, to then starting to develop a framework of the mind, which would be the psychological framework. And then sort of the modern era of science and the scientific method emerged. So now we shifted from subjective psychological frameworks to now ever increasingly nuanced biological or biopsychological models. But then the further we get down into the brain, we always seem to try to then at some point come back and say, so then how does this explain how I think? How does this explain how I feel? And how does this explain why I decide to do a certain thing? So I do love that cycle, and it does seem to repeat. And then we go back down into a deeper level of biology, and then we always try to bring it back, or at least I hope we do, to explain better and more accurately how it is we think, feel, and act. And so it goes again. And so it has been for dreams.
Yeah, it starts with us and ends with us.
I hope so, although with the advent of AI, it may start with us, but it may not end. I'm a techno-optimist. I embrace it all. I'm a rational optimist too. So
I'm actually reading a book called Nexus. Have you heard of it?
Oh,
Yuval Noah Harari. Yeah.
Yes. Yeah, exactly.
It scares you about AI pretty well.
Yeah. Well, I think his last book, Homo Deus, correct, was foreshadowing now, I think, so much of where we're at. And I often think of the beautiful movie with Scarlett Johansson, and you're going to tell me the other actor. He's brilliant. I love him. Can't remember his name. And it was called Her, Her.
Joaquin Phoenix.
Joaquin Phoenix, thank you. I think he's an absolute genius. And that movie, gosh, it may be 10 years old now. I'm dating myself, but I remember when it came out and you're thinking, this is just right on the cusp of plausible to think, yes, someday in like 30 years' time, this is going to happen.
And it's
But
much faster.
now, 10 years later, not 30 years later, some people were showing me a model on Grok that kind of does basically the version of chat with Scarlett Johansson. It was, yeah, I switched that feature off pretty quickly. Anyway, it says more about me than the feature. Next question.
Actually, I want to ask listeners, please ask Matt, why is he optimistic about AI? I want to hear his answer.
I will gladly give it. Let's put that down for the next one.
All right, next question. My husband falls asleep in 30 seconds while I lay there for hours. Help. Is this a guy thing or is something wrong with me?
Well, as a guy, I can definitely speak to the fact that, yes, I've fallen asleep within 30 seconds, but I've also very much had the experience that this individual is having where
we're actually the opposite.
Hours. Yeah. I would actually say, well, first, it sounds like it's causing you distress, and lying there for hours is not the right or appropriate feeling and experience that you should have as a sleeper. You deserve better. And there are some great tools and techniques out there. Cognitive behavioral therapy for insomnia is wonderful to help you learn better ways to fall asleep more quickly and stay asleep more soundly. Many people choose not to do that. There are also medications. I've done a podcast with Ranjiv Varghese. We actually have released 2 episodes now on this show about sleeping pills. And it's, I think, a fantastic roadmap and a guide to how you can think about whether or not they are the right things for you or the wrong things for you. So firstly, I just want to make that point in that regard. You shouldn't be suffering the hours of, I think, what can often be torture of being awake. And there are ways that you can certainly find a better sleeping life for yourself by way of things like cognitive behavioral therapy for insomnia, or CBTI for short. You make a change, and that change is the following. You go from your sleep controlling you to then walking into the bedroom and you control your sleep. That's a radically different feeling of confidence. So know that it's out there if you want to explore it. To your question, though, I would actually say I'm equally concerned about your husband because falling asleep too quickly, let's say under a minute, For us in the sleep world, we often worry that that could be, now it could be fine, but it could also be that your husband is carrying a lingering and chronic ongoing sleep debt. In other words, they are chronically sleep deprived. And when you are chronically sleep deprived because you have such a strong, heavy debt that is weighing you down, as soon as you put your head on the pillow, because you're so deprived of this thing night after night after night, boy, do you fall asleep very, very quickly. Setting that aside, we know, I think it was maybe Shackleton, I can't remember, but they had published some evidence that women on average will generally take longer to fall asleep than men. Some of that has to do with higher levels of cognitive activity and thinking before bed and once you get into bed. There are also some hormonal fluctuations. Men, on the other hand, can also, there's a little bit of evidence that they may build up more what we call sleep pressure across the day. It's possible that that's due to greater levels of the chemical that regulates how sleepy you feel. And that's when we say sleep pressure, I'm talking about the sleepiness that builds up across the day. It may be that men actually develop a greater level of adenosine buildup, at least up until the age of about 50. And therefore, that's why when they try to fall asleep, they are weighed down by a greater degree of sleep pressure than women are. Although, again, I think that data is not especially strong. We also know that women will suffer levels of anxiety disorders at rates far higher than men. I think if you look at the data, it can be 2 to 2.5 times the rates of anxiety disorders are observed in women than they are men. And we know that probably one of the principal reasons that most people can't fall asleep easily is because that Rolodex of anxiety and the stress, and then it triggers a cortisol release, which leads to racing thoughts, and you catastrophize, and everything feels twice as bad in the dark of night than the light of day. And at that point, it's tricky. So I would say to this person, I wouldn't immediately assume that your husband's rapid sleep onset is a wonderful talent. I know it may feel enviable when you can't fall asleep quickly. But I would also say just make sure for your husband, it's not sort of a sleep debt, such that, let's say that you went on vacation, or let's say that the alarm didn't go off in the morning. Would your husband sleep past that alarm? And if the answer is yes, then they're probably not done with sleep. That's usually one of my first markers of when people say, how do I know if I'm getting enough sleep? If your alarm didn't go off, would you sleep past it? If yes, probably not getting enough sleep. Is there anything that I've missed there?
No, I just think that it's nice how in one question we get to talk about falling asleep too quickly and taking too long to fall asleep. And kind of the answer is to meet in the middle. And one thing maybe that I would suggest is figuring out if the time that you go to sleep is good for you. You mentioned many times, Matt, that people try to go to sleep early because they want to get enough sleep. But if it's not in line with their chronotype, they'll just stay in bed awake.
Yeah, I think that's a really important note is sometimes people will come in some of the studies that I've been involved with, and they'll say, I've got terrible sleep onset insomnia. And then we try to learn their chronotype, and it turns out they're a night owl. Their biology wants them to sleep from 1 a.m. to 9 a.m. But because of the way life is for them, they have to get to bed at 10 p.m. and wake up at 6 a.m. They don't have sleep onset insomnia. They have a mismatch between when their biology wants them to fall asleep versus when life is forcing them to sleep on the 24-hour clock face.
Exactly.
A partner for today's episode is AG1. What is AG1? AG1 is a nutritional drink, and it contains a whole constellation of antioxidants, biotics, minerals, essential vitamins. It's a long list, but you get the the comprehensive picture, let's say. I've never been interested in fads or quick fixes with diets. It just doesn't work. And that's not what AG1 is about. I've been using AG1 for the past couple of years. I have been using it. And just to note, I do buy it myself. I'm not interested in the idea of freebies for the obvious trappings. But one of the reasons that I've been using it is because I did my research on the science behind the ingredients, and I do place a high priority on scientific data as ground truth. The new formulation that AG1 has, it has over, I think it's 50 revisions and improvements. That's how dedicated they are. And you can try AG1 and get a free 1-year supply of both vitamin D and K2. And for listeners of this podcast, you can also get, in addition to those things, 5 free AG1 travel packs with your first subscription. Head on over to drinkag1.com/Matt Walker. Again, that is drinkag1.com/Matt Walker.
Next one?
Yes, next question.
After starting antidepressants, I no longer remember any of my dreams. Should I be concerned about that?
Did they mention? They probably didn't mention which
If they remembered.
antidepressant, because it can be. There are obviously a number of different antidepressants, and it would. But for the most part, actually, it wouldn't really change the answer here. But
I thought you wanted to know if they remember their dreams before.
Oh, that's a good question too, which is the relative baseline. Yeah, what are we talking here in terms of the comparison? That's a good question. I suspect that probably they are on either an SSRI or an SNRI, which, let me explain. Firstly, to say it is a common side effect and that you don't remember your dreams once you started antidepressants. And I guess the sort of question, which is after starting antidepressants, I no longer remember my dreams. I guess it means that they probably may have done beforehand. If that's the case, it's not necessarily a sign to be concerned about or something that is harmful. It does indicate probably a change in your sleep architecture, though. We know that many antidepressants, particularly what we call the selective serotonin reuptake inhibitors, or the SSRIs, and then the sort of sister class of drugs, the SNRIs, which stands for serotonin norepinephrine reuptake inhibitors. They alter sleep patterns in the following ways. Firstly, those serotonin-based reuptake inhibitors will reduce the amount of rapid eye movement sleep. So antidepressants can decrease REM sleep, and REM sleep is the stage that we know is associated with most vivid dreaming. Some studies suggest, depending on the dose and the naivety of the patient to the medication, it can decrease REM sleep by up to 30 to 40%. I think there was a paper by Peterson, maybe 2015. I'll have to look, but certainly we know that that literature is very robust, that antidepressants will reduce REM sleep. In fact, sometimes if you want to try to experimentally decrease REM sleep in healthy human beings, you will use antidepressants as a pharmacological experimental tool to dial down the volume on REM sleep. And we also know that they will be associated with fragmented REM sleep. So normally when we have REM sleep, we have these long consolidated bouts of REM sleep, particularly in the last kind of 2 or 3 hours of the night. But people on antidepressants may have much more brief interrupted REM sleep periods rather than long consolidated uninterrupted periods of REM sleep. And that can make dream recall less frequent. There was a great study by my colleague Edward Pace-Shott back at Harvard in the early 2000s that I think reported that. We also know that some antidepressants can increase deep sleep, which can then, as a consequence, reduce the amount of REM sleep, or certainly it can reduce the amount of dream recall from the REM sleep that you nevertheless get. I think, again, that was Roseanne Armitage who published that data. Should you be concerned? Again, we can't be medically prescriptive or descriptive, but I think what science would suggest at this stage is maybe not necessarily. While REM sleep is important, we've spoken about it many a time for emotional processing and memory processing and hormonal rebalancing, its temporary reduction due to medication does not, and the size of it at least, does not typically harm cognitive function if you look at the studies. And in fact, if anything, some studies have even suggested that lowering levels of REM sleep in patients with depression can even be a helpful treatment of depression. And in fact, some people have argued that the antidepressant benefit of some of these sleep medications comes by way of modulating REM sleep. So in fact, this manipulation of REM sleep, and REM sleep may go awry in untreated depression. And the treatment with these medications may bring REM sleep back into more regulated control and therefore have an antidepressant benefit. So it could actually be not just something that you should not be concerned about, but something that maybe is to be embraced. I just don't know if the data is 100% clear on those things. Eti, can you be clearer and help me?
I just wanted to add that, first of all, the fact that we don't remember dreams doesn't mean we don't dream. So there may be a reduction, but it also doesn't mean that REM is completely abolished. And you're right about the changes that we're seeing in REM sleep and depression, in that we don't really know what's the chicken and the egg. Is it the fact that REM sleep is disrupted that's causing depression, or is depression kind of somehow worsening REM sleep? And how do we fix it? But we do see this clean association where change in REM sleep does mean a beneficial impact on emotion and on depression.
Indeed. And that's why I think it's always so sort of tempting when you hear, oh, in a news article or in a social media post, antidepressants change REM sleep. And then all of a sudden people get fearful when you don't realize that, in fact, REM sleep may have been dysregulated
Mm-hmm.
by having the condition, and the antidepressants by changing the REM sleep, that people are saying, oh my goodness, be careful. Antidepressants change your REM sleep, but it's the changing REM sleep that puts you back into non-REM REM sleep balance that is beneficial. And I think
Yeah.
that's always the way that, at least I remember one of my professors when I was back at the Queen's Medical School in the UK, he said, I know patients often have an adverse reaction to the idea of having to take medication, to say, I always want to stay natural. I don't like taking medications. And the idea, I think, behind that understandable dislike of taking medications is that when I take a medication, I'm doing something abnormal to my body. I'm putting my body out of balance. And his response was, well, maybe if you could consider the fact that the reason you're coming to see me here as a doctor is because you're suffering from a condition, which means that you must be biologically out of balance. And the medications that we're going to provide you will put you harmoniously back, or at least closer to, biological balance. So try not to think about these medications as doing you an artificial injustice. It's that they're returning you back to a state of closer biological normality. Because right now, the reason you're experiencing whatever symptoms you are is because biologically you are out of balance. I always thought that was a very interesting antithetical way of looking at it.
Such a good point. It reminds me basically of the word disease is being a
Mhm.
disease. You want to come back to that baseline, to the biological balance. I love that.
I love the fact that we really do embrace words in at the Sleep Center, don't we? You teach me lots too, and I'm sorry I always bang on at people to go to the etymology of the word. Anyway, speaking of, let's go to the next question.
Next question. I've heard about people dreaming about things that then come true. I've heard it from a few people, which seems to suggest it could be real. How is this possible?
I actually did a podcast on this because there was a scientific paper that spoke to this. Probably I'll have to dig back and we can put it in the show notes, but I think it was probably maybe about 3 or 4 months ago. You can just search it for precognitive dreams. And that's what this person is speaking about, that people have a dream about something that then happens in the future. And it has long fascinated scientists and psychologists, and conspiratorial theorists abound. Many people will believe that their dreams predict the future, which is so understandable because even I've had that experience where I've dreamt about something and then a week later or 2 months later, that thing happens, and it happens so closely in terms of its match and its homology between what I dreamt several months ago or weeks ago and what happened. I just think, hang on a second, that has to be a precognitive dream. I must have dreamt about what this thing was going to be long before it actually happened. That was real. But I'm going to pop that bubble and send people hurtling statistically back down to earth, because while many people think that their dreams are predictive, the explanation really lies in the computation of statistics and psychology rather than the paranormal. There is something called the law of large numbers. And given how many dreams people will have over their lifetime, and let's just say that each person has 5 REM sleep cycles a night. And let's assume, to be really conservative, that you only have one dream per REM cycle every night. So every person has just 5 dreams every night, which based on the data, we probably have more like 10 or 15. But let's just conservative 5. Well, firstly, just think about the fact that if there are 7.5, 8 billion people on this planet, and let's just say for the most part, the infants who are not dreaming, let's boil it down to just, again, to be conservative, 7 billion people. 7 billion multiplied by 5, because each one of those 7 billion is having 5 dreams a night. If you run the statistics, it is highly, highly unlikely that someone doesn't have a prescriptive dream that matches almost to the letter what happens the next day. Just by statistical chance alone, by the law of large numbers, you will absolutely get an almost perfect fit with what someone dreamed the night before and what happened the next day. And they will scratch their head and say, I'm a prophet. It's just statistical chance. So there is that. And then there is also, some evidence. It wasn't Bob Stickgold, a former friend of mine at Harvard, but they looked at retrospective bias, basically confirmation bias, and people tend to misremember or reshape past dreams to fit real world events after they occur. So you kind of don't really accurately predict. You basically mold and you morph and you kind of squint your eyes and you change it to kind of fit a little bit better. This was work, I think, by Erin Wormsley and Bob Stickgold, and they looked at subconscious pattern recognition. And our brain constantly processes subtle cues from our daily life. And sometimes dreams reflect just that sort of subconscious deduction about future events. Because the best predictor of the future turns out to be, drumroll, the past. It can feel a little bit eerie or prophetic, but it's not really. It's just the fact that based on what was happening today, most people can probably make a not too far inaccurate prediction of what's going to happen tomorrow about certain things. And that happens in our dreams as well. So is there any scientific proof? No. There are no controlled studies, no experimental studies that I know of. In fact, quite the opposite, that confirm that dreams can predict the future beyond random statistical chance alone. I know it's not fun to hear. I wish it weren't. I would love to have that magic as well. It's not to say that dreams don't reflect intuitive thinking and problem solving. They absolutely do. And that may be an explanation as to why they sometimes seem predictive. But for the most part, it's just raw, statistical, annoying chance.
I think also it's, if you want to look at it optimistically, some of the models about why we dream suggest that it is to try and predict our world. So if you have a dream that ended up happening, it means your brain is doing something right.
It's doing its pattern recognition, right?
Yeah, exactly. It means you figured out something. And I wish there was a way to kind of win the lottery every time we have such a dream. If only we could prove it. Because the chances are we will have more of these dreams than ever win the lottery, right?
You would think. By the way, since I've primed you to that lottery idea in this podcast, when you do win, don't forget who pointed you in that prophetic direction of the numbers that you chose. I'll be coming for you.
This is subconscious inception now.
Here we go. And with that, I think we will round out this AMA on the prophetically depressing note of statistics. Eti, thank you so much for just course correcting it. I don't think I was particularly quick in this AMA at all, but we may have got through at least 1.2 questions more on average than we did before, I think.
You were wonderfully full of information.
Ever the diplomat. I should give you my title. All right. Eti, thank you so much. Listeners, thank you so much. Eti, just remind people, where can they find you on this wonderful thing called the outside world of digital?
You can send me emails. I love getting your question at etoosh, etoosh @gmail.com. And Etoosh is also my handle on X or Twitter. Please write to me.
Fantastic. And with that, folks, thank you for listening. Take care, sleep well, and we will see you in the next episode. Bye for now.